The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to this month's Psych Central webinar presentation. We have a great presenter lined up, but before we get started, a couple of housekeeping items. You can type in your questions at any point that you want, but the presenter will not answer them until the end of the session. So again, you can type them in whenever you see them, and we'll do a moderated question and answer at the end. Also, when we get to the end, you'll have another opportunity to ask your questions, and our presenter will absolutely answer them. And without further ado, I present Nancy. Nancy?
Hi, I'm Nancy Gomez, and right now I'm living 10,000 feet above sea level in Quito, Ecuador. I will be returning to the States at the end of the year, but that just means more deep breaths for me. I have worked with the severely mentally ill and the abused children for over 25 years. And I went to GW and Columbia and also Marymount for another master's. And I graduated my BA from the University of Maryland. So go Terps. So that's about it for me. Excuse me. So we're going to talk about passive-aggressive personality. And passive-aggressive personality used to be classified in the DSM. The DSM is a diagnostic statistical manual, which is our Bible, so that we can diagnose. And it has every mental disorder that exists, and that a group of psychiatrists decided should be included. It changes every, I don't know, it can be every 3 years or such. A modified version can come out. It was passive-aggressive personality. It used to be classified in the DSM as a disorder until 1940. Now, there are talks to reinstate it as a personality disorder, along with others such as narcissistic personality disorder, borderline personality disorder, there's histrionic, obsessive compulsive, and so on. Now, what is passive-aggressive personality? Well, first and foremost, it's a form of anger. However, it's expressed in a passive manner, as the name suggests. The aggression/anger is suppressed, and the anger is suppressed and expressed via behaviors such as procrastination, backhanded compliments, sabotage, to name a few. Passive-aggressive people express their negative feelings through their actions while seemingly appearing to go along with what is being proposed. Now, this can happen at home, school, work, or relationships. An example might be procrastinating on a request to do something like do the dishes, or poorly completing an assignment because you really didn't want it assigned to you. Sorry, had to have some water there. Characteristics, well, there are a lot of them, but the two of them that stand out, or that are the main categories, are disguised verbal hostility. This means negative gossip, sarcasm. Sarcasm is actually veiled hostility, veiled hostile joking, repetitive teasing, habitual criticism of ideas, solutions, conditions, and expectations. In other words, left-handed compliments. Disguised relational hostility is like the silent treatment, backstabbing, being two-faced, mixed messages, deliberate button pushing or provocation, sullen resentment, indirectly hurting something or someone of importance to the targeted person. Disguised task hostility. That's like what I was talking about: procrastination, forgetting, stonewalling, withholding resources or information, arriving late to on purpose, late to a meeting, not having all of the information with you, denying personal responsibility, deny, you know, oh, well, you know, the copying department did not hand me in the assignment on time, excuse making, blaming, broken agreements, lack of follow through, rigidity and avoidance. Remember rigidity. Hostility towards others through self-punishment, like I'll show you, like quitting, deliberate failure, victimhood, dependency. Behaviors. Like I said, the term passive-aggressive was first widely used in the 40s by the United States War Department in 1945 at the end of World War II. It was used to describe soldiers who passively refused to obey orders by working inefficiently, procrastinating, and sulking. Now, fortunately or unfortunately, our brave veterans have been used to examine and discover lots of behavioral disorders because of the extreme stress that they faced during wartime. For example, in World War I, they discovered soldiers who suffered from shell shock, which is now referred to as PTSD. So that's a little trivia for your next cocktail party. Causes: one's family history. Was there a strong and possibly domineering parent or sibling in the passive-aggressive's life? Authoritarian parents or parent? Was there competition for affection, attention, and approval? The passive-aggressive person could have witnessed or observed others in the family using passive-aggressive tactics to resist or avoid flight, you know, fight or flight, or stonewall, freeze, against somebody, one of the parents' onslaughts of attack. Were difficult emotions such as anger, frustration, hurt, defensiveness, or resentment kept hidden but simmering. What happens usually is that those feelings, those negative feelings, are not permitted. They're only permitted by the authoritarian parent. And it forces the person, the child, to learn to stuff down their feelings. And then, because such fear has been ingrained, then they learn to sidestep any direct confrontation or addressing their feelings, addressing of feelings, and they use left-handed compliments or underhanded remarks, or things like, oh, well, I thought you would have liked it. I tried, I worked really hard on it. You know, eliciting in another person a feeling of guilt or wanting to apologize. They're not always going to show, well, they're not going to show they're angry or resentful. They are going to appear, manifest themselves as people-pleasing, the friendly, down-to-earth, kind, and well-meaning person. However, underneath, there's going to be manipulation going on, hence the term passive aggressive. And it comes up when an individual feels powerless and lacks a strong voice in a challenging environment. So depending upon how severe that was in their childhood and whether or not they received any help, which they probably won't, be in therapy. You're not going to find a whole lot of passive aggressive people in therapy unless they're forced to go or something. Excuse me. Then what happens is also how fragile their ego is. So it could be that once you start talking to them about something that, you know, they didn't quite finish or do well or whatever, then they're going to start to shut down, and they will, you know, revert to form, which is their passive aggressive behavior. People often think that anger and aggression are the same, but they're not. Anger occurs in response to an unpleasant or threatening stimuli, whereas aggression is behavior intended to cause harm. Aggression can occur without anger. A person tackling a football player tackling someone in a game is being aggressive, but not necessarily angry. But generally, anger is a common cause of aggression, and that is what is being hidden. Anger, resentment, rage, anything negative, even disagreement. Other behaviors are the silent treatment. That consists of completely ignoring another person and perhaps even refusing to acknowledge their presence. But there are more subtle ways that a person may subject you to the silent treatment. For example, they may accidentally fail to acknowledge you in the hallway at work, only it happens at random, so you have trouble knowing whether it's deliberate or accidental. Or you can have ghosting, which is complete disappearance and uncontactable, so that they fall off the face of the earth. But I'm going to talk more about that in a minute. Other behaviors are withholding behaviors such as sex, cooking, cleaning, not doing their part at home, forgetting to take the kids out. I mean, any one of a number of examples at home, but it's done as a rebellion. It's the aggression. It puts the onus on the other person to pick up after them. And then the other person gets resentful. But guess what? That is the passive aggressive's way of manipulating you to feel their feelings for you, for them. And there's also learned helplessness, deliberately doing a poor job of something so that the other person has to step in or feels obligated to step in. So I picked this picture because really the passive aggressive person is prisoner. They're truly held prisoner of their feelings, negative feelings. So long as you're complimenting them, so long as they're feeling good and they're being fed, and you're not triggering them by, say, making an observation, then they're fine. Otherwise, forget it. Fear of competition. They avoid situations where one party will be seen as better at something. Ambiguity, they'll be cryptic, unclear, not fully engaging in conversations. Like, yeah, I'll do that. Or yeah, I agree. chronic lateness, and chronic forgetting. All of these allow the passive-aggressive person to be in control over other people and their expectations, while showing blatant disregard, i.e. aggression, for others as their punishment. So it's very manipulative and covert, but it's not that the passive-aggressive person sits down and says, okay, this is what I'm going to do. Like I said, it's a default behavior, a default setting that they learned in childhood. Noncommunication, when clearly there's a problem, avoiding or ignoring, they're conflict averse. There's just no conflict allowed. They'll either shut down or look down, or they can be clenching their fists, or they can just dissociate, meaning they can just tune out, evading problems and issues, burying an angry head in the sand, obstructing, deliberately stalling or preventing an event or process of change. Making excuses, blaming, rather than taking responsibility for their actions. It's not going to be, you can hear, I'm sorry, I'm really sorry that hurt you, I'm never going to do that again, and that's really not addressing a problem. I'm sorry is great to hear, but unless it's going to be followed by change, then it's just words, and they would rather not delve into a conversation where they have to look in the mirror and see their faults. Victimizations, they're very good at turning the tables to become the victim. Like, oh, I just didn't know while I was trying. Well, I hardly get credit. I mean, this is hard for me, and stuff like that. Other behaviors are a fear of intimacy. There can be trust issues with passive-aggressive people, and guarding against becoming too intimately involved or attached will be a way for them to feel in control of the relationship. They can be on and off. They can appear not to make up their mind. And the more you push them, the more you get the passive-aggressive reaction. Intimacy is something that's very difficult for them, and because it requires being vulnerable. And the last time they were vulnerable was when they, were in their childhood, when they were punished for having certain unacceptable feelings. Okay, comorbidity. And I spelled that wrong. Okay, first we need to remember that passive-aggressive personality used to be a part of what is called cluster B personality disorders. As late as 2009, there have been studies to return passive-aggressive personality to this group of disorders. And they include, as I mentioned, narcissistic personality disorder, antisocial, histrionic, borderline. Passive-aggressive personality resembles narcissism with the characteristics of exaggerated sense of self-worth, lack of impulse control, and inability to empathize. That is very important because they are so overwhelmed by those feelings that they have to stuff them down and use covert ways of expressing those, those feelings in a passive manner. They have a very limited, if non-existent, ability to empathize. In other words, to put themselves in your shoes, because it's just too uncomfortable. It's just too uncomfortable. And to hear the fact that you or that they made you feel this way is just totally overwhelming. Hallmark behaviors is the silent treatment. Not the kind of timeout that people take when in an argument, like they won't talk for a few hours, or, they might say goodnight, and then in the morning they might resume either the argument or talk. It's a complete shutting down and annihilation of the other person, which is what happened to them. Usually, like I said, this is a person who has developed a conflict-averse type of attachment from childhood, wherein any type of criticism or observation is received as an ego injury, and they disappear. They can't, they might be able to write you a letter, but they can't confront you, even on the phone. They cannot, it's just not in them to do that. Sullen behavior. It paints a picture of an emotionally immature person, which is what they are, as you can see by how they handle their emotions, who express their disagreement through being moody and generally negativistic. And it's a combination of, like in the picture, someone who's hurt and angry. Never forget that anger is included in that. How to deal with somebody who's passive aggressive. Now, it's very different if you're in an office and it's your boss, and maybe you can just listen to the tasks that they give you rather than engage in an involved conversation, or if it's a colleague that you can ignore. In a couple, in relational situations, be it mother or father, what you don't want to do is worry about getting to know their history, because I can sit here and write a doctoral paper on passive aggressiveness, complete with charts and all the bells and whistles, but that's not going to help me deal. Because when you're in the moment, you have to remember yourself and your boundaries. You have to remember to listen to your gut, see if this is feeling uncomfortable. Unless you've done something wrong, don't apologize. You might feel like apologizing. Oh, I thought you'd like this place because it was, I had looked it up and online and it got some really great reviews. What they want you to do is apologize in that example. You do not want to worry about being a trigger. Because you will end up living your life or living that relationship walking on eggshells. And you do not want to try and rescue them. None of the personality disorders, nobody who is drowning should you try and attempt to rescue, because they will bring you down. It's like this picture. Here's a rescue helicopter, but for our purposes, you see a line, a rope coming down from it, but you don't know what's at the end of the line. And like I said, no matter how much you've read, how many webinars you've listened to, you do not have to rescue them. It is not your job to do that. It's your job to set your own boundaries and follow through on them, because otherwise you're going to drown. What you do want to do is remember that it takes two people. It takes someone to enable and play the game with the passive aggressive person, play the game of if they try and elicit apologies or compliments, or they elicit a feeling in you of wanting to put yourself down and say, oh no, it was my fault, of blame. If you refuse to do that and you stay within your boundaries, then you're not playing their game and you're not caught up in it. You can identify the behavior for what it is, which is hostility and control. And I'm not talking about a confrontation, but something like, you know, it seems like you're not too happy with what I said, or I'm wondering what, you sound like you really resent the fact that I went out and did XYZ activity without you. I wonder what that's about. You can practice assertive communication in hopes that they will mimic that in your relationship. You should always have assertive communication, talking about how you feel, stating that you don't like something, and things like that. But don't play the game and get triggered, because all what's happening is that instead of them expressing that they're angry or resentful or they didn't like something, you're getting angry for them. Love and passive aggressive people. Well, they have difficulty with emotional honesty and open dialogue, as we've heard. So the emphasis is on the partner to avoid triggering passive aggressive behavior. And hopefully that, you know, the passive aggressive person agrees to go to therapy. But you can bet that they will be passive aggressive in the session as well, and forget to, you know, talk about XYZ event that happened, or hide, you know, less desirable, you know, personality features of themselves. You can read their body language and make observation comments like, I feel uncomfortable with XYZ because it feels like you're angry. Like I said, no confrontations, and you want to use I messages. When you do this, I feel like you are really telling me that you're angry with me. You want to set your boundaries and follow through. There was an example I read about someone moving in and the partner did not make room for them, and they said, well, I'm going to need to unpack my things, so I'm going to need room. I'm going to need for you to do that by, to make room for me by Monday. And then if they, or either I'm going to have to move out, and then you have to follow through. So it's a lot of work. And it's something that you need to really think twice about, because in love, you have to use your head too. And you may be really liking somebody, but this is a lot of work if somebody is displaying these types of behavior, and telling them that they're acting this way is not going to help. They will become defensive. I think anybody would. The summary is that this is from their upbringing. Some suggest that passive-aggressive behavior may stem from being raised in an environment where the direct expression of emotions was discouraged or not allowed. And that is a lot of damage, because you have to be super, super aware and mindful of anything that you want to eliminate from your behavior or add to your behavior. And learning to feel your feelings, learning to sit with your feelings, learning to say, I don't feel good, I don't like this, can be frightening and just make the person petrified. Taking the easy road. Being assertive and emotionally open is not always easy. When standing up for yourself is difficult or even scary, passive aggression might seem like an easier way to deal with your emotions without having to confront the source of your anger. They were not taught to say, look, this is not right. I disagree with you. I don't feel good about this. That is absolutely something that is not in their skill set. Personality disorders make up a group of mental illnesses in which a person displays long-term rigid patterns of behavior and thoughts that don't adapt to a wide range of settings. So, narcissistic personality disorder, passive-aggressive personality, antisocial, these are people who have long-term, meaning decades, of practice so that their patterns of behavior are pretty much set in stone. And their thoughts, the way they rationalize that, don't adapt to situations that you and I are used to, like disagreeing, giving someone the benefit of the doubt, and sitting with feeling bad until that other person cools off, and then coming back to the table and discussing it. Unfortunately, especially narcissistic personality disorder and passive-aggressive personality behavior, there isn't any tried and true therapy, because when you are trying to change something, you have to police it first, and you have to be constantly aware of it until it's more natural, and that takes time. And passive-aggressive people are not very open people, and they don't like to sit with anything uncomfortable. Not that anybody does, but we're talking about to the point where it is destructive in a relationship. And being silent or ghosting, usually it's someone who is narcissistic with passive-aggressive tendencies. So it is, excuse me, very difficult. These are the references which you can look at on the replay. And to work with me, I'm going to have my website published within a couple of weeks, and I will be on Facebook and Instagram within a week. And in the meantime, you can contact me at couchissues@gmail.com. And that's it.
Wonderful. That was excellent. Thank you so much. We have a couple of questions, but I want to remind the listening audience that now is the perfect time to type in your questions, and Nancy will answer as many as she can. So please go ahead and pop open the question box and ask away, and we'll get started with the. We have two, but they're both pretty much the same, and it says this, it says, you paint a pretty bleak picture of somebody who is passive aggressive or has narcissism. Is there any hope, or should we just abandon them now?
Well, abandoning, of course, we would have to get into, you would have to be more specific of what you mean by abandoning them. If we're talking about family, it might be so toxic, that you need to limit the time that you interact with them. If we're talking about a workplace, that's a lot more difficult, and I gave you some examples about managing someone who is passive aggressive or actually passive aggressive. If we're talking about a love relationship, the minute you start to not feel good about yourself, and the minute you start seeing patterns never lie. Red flags are there for a reason. And the minute that you start putting two and two together, which is why you should let the other person talk so you can get to know them, then if for a narcissistic personality disorder, it's not always going to be clear cut, because people do not behave like a psychology textbook. And they don't behave in order. They don't behave accordingly. It's like the what they say about grief. You know, you have the denial, the anger, the bargaining. You know, it doesn't happen in a straight line. You know, you might be all the way to acceptance, and then you hear a song, and you're all the way back to denial, or you're all the way back to anger, you're all the way back to bargaining. But if you start seeing these behaviors, be it narcissistic behaviors, passive aggressive behaviors, know that it's not going to be an easy ride. It's not going to be a pleasant ride, and they have an immature, emotional immaturity. And if you are in a place where you know who you are, you're being constructive in life, you are being, you have your boundaries set, you know what are deal breakers for you, you know what lines in the sand people are not allowed to cross. And if they start making you feel bad, then trust your gut and run in the other direction, because that's just the way it is. With these types of personality disorders, they are too ingrained. Passive aggressive people are going to have you, they are going to be provoking you. You're going to be getting angry at them because they don't, getting angry for them because of them. They don't know how to relate. And it's unfortunate, but, and they can come off very people-pleasing, very just wonderfully nice, and just, oh, fantastic. And so you want to keep your guard up for, or your eye out for for this, for these behaviors and for how they present. Somebody is sounding too good to be true at the beginning, and it's, you know, overly solicitous or something like that. There's usually something to hide, because in life there should be balance, an equilibrium of mood, you know, be it when you eat, you know, I mean, you can have chocolate cookies, but don't eat the whole bag or else you'll be gaining weight. I mean, it's the same with personality. Personality, people who have personality disorders or personality behaviors that are not very adaptable. And that's why they're not adaptable, because they can't feel all of the feelings. They can't, they're not able to sustain a conversation about either what they did wrong or what was happening that made you feel bad. You know, if you keep your eye out, you'll find them.
Thank you so much, Nancy. The next question is if somebody does have one of these personality disorders and they want to change, can they? Is it theoretically possible?
Theoretically, it's not likely. It's possible that they can go to, and I know this for a fact, that they can go to come to therapy. They can read all sorts of books. They're excellent self-help books, you know, online, and then also the ones that are suggested for you. And so there's a lot of information out there. But here's the deal: when you read about narcissistic personality disorder or passive-aggressive behavior, that's all fine and well. It's practicing and going to therapy once a week and making sure that they practice, you know, what they're learning. That's a lot. Now, if they don't want to express if they're not able to express their feelings in the first place, how likely is it that they are going to follow a program of therapy wherein that's exactly what they're obligated to do? So if you want to hang in there and, you know, be somewhat of a coach and so on, then that's going to be a lot of work, and it's going to wear you out. Now you can try, you know, but there isn't these behaviors, again, are in concrete. I mean, they're set in stone pretty much. This is how they've lived. You know, this is how they were trained at a young age, and this is what they know. And so you're to undo that as an adult is very, very difficult. They can, you know, passive-aggressive people can come to therapy, and you can say, okay, how about if you come twice a week, and this homework I'm going to give you. They will start off very enthusiastically and wanting to please. Remember the people-pleasing aspect. They will want to please you, or yeah, basically please you, and show how wonderful they are, but they're going to drop it. It's too hard. That's the answer.
I understand completely. Thank you so much. It looks like we are out of questions. I always like to give it just another 30 seconds. Do you have any final words, Nancy, assuming that there's no other questions? Any tidbits of wisdom to wrap us up and take us out?
Well, you know, I may have painted a bleak picture because these people, if you you know, get to know them as at a cocktail party, at a gathering or whatever, and you're talking to them and you start seeing some signs or whatever, or you start going out with them, you can have a nice time and everything, but just know that these behaviors exist and their description exists for a reason. And, a lot of people fall into oh, I'm going to be the one that, really reach that person. And you're not going to see it coming. You're not going to see it coming unless you pay attention to your gut. And because you can be swept away, and you just have to keep your eyes open, because they have learned, it's sort of like someone who is illiterate. They've learned different tricks to pretend that they are reading. Well, people who are passive aggressive have learned how not to get into a discussion, or they will refuse, they will avoid, they will withhold, they just will be like a mime of feelings, not a person who talks about them. Not that you have to know how to talk about it like a therapist, but to be able to say, you know what, I was wrong. And maybe you're hating it inside, but you know that you were wrong. But they will think of a mime. They will just mime their behaviors and their feelings, and they will find a way to provoke you so that you have those feelings, not them. And it's just a chore. And I know it's not pretty, but that's why it's a disorder. And there aren't any proven techniques or medications to help with that. It's a result of a trauma of being silenced, having your anger silenced. Imagine having that all of your life, your childhood. And then you get out into the world and somebody starts arguing with you, and you stand there and you don't know what to do, or either you answer in a sarcastic manner or you avoid them. That's my final that's my final word.
We completely understand. Thank you so much, Nancy, for sharing your time with us. We really, really appreciate it. And thank you, everybody, for tuning in to this month's Psych Central webinar series. And we will see you all next month. Thank you so much.